For many of you who want to retire before the age of 65, health insurance is one of your primary concerns before you pull the trigger. The idea of leaving an employer plan before Medicare can feel risky, expensive, and confusing. And in many cases, people assume that options simply aren't workable. The reality, though, is that early retirement insurance is complex, but it isn't impossible. And with proper planning, it can be far more affordable than most people expect. Before Medicare eligibility at age 65, retirees generally have three broad paths for coverage. One of the options that people have is COBRA insurance, which allows you to stay on your employer plan but only for a limited time. And it often comes at a very high cost because you're paying the full premium yourself. Another option is health sharing plans or co-op style plans like Medicare, which can work for some families but are not traditional insurance and come with important limitations. The majority of today's conversation, however, centers around the plans offered through the Affordable Care Act marketplace, because that's where the most flexibility and the largest potential subsidies exist. ACA plans are a hot topic and are constantly subject to political and legislative change. We saw this clearly during the COVID era, with subsidy expansions and ongoing debates in Washington continuing to shape how generous these credits are or are not. That uncertainty alone causes many people to dismiss the marketplace entirely. But regardless of future changes, the underlying structure of how subsidies work today is something that every early retiree should understand or have a grasp of. With the number of changes that happen in these plans, you can assume that the numbers that I show you in this video will change as soon as next year. And I think we all have seen insurance increases over the last few years and don't expect those to stop. So take this video as educational and not prescriptive of the exact plans for you and your family. Okay, back to the topic. Marketplace subsidies are based on income and not your assets, and they are calculated using your modified adjusted gross income. To see how meaningful this can be, I ran several real quotes through Healthcare.gov for my zip code where I live in the state of Arkansas. These exact numbers will vary by state and plan availability, but the mechanics are consistent nationwide and can be used as an example. In the first scenario, I looked at a married couple who are both age 57, earning $45,000 per year. At that income level, the marketplace provides a monthly premium credit of $2,687 or over $32,000 annually. That credit dramatically reshapes what insurance can look like for an early retiree. One option available to them was a bronze plan with a monthly premium of just 18 cents, though it came with a $15,000 deductible and a $20,000 maximum out of pocket. Another option was through Blue Cross Blue Shield that offered a monthly premium of $378.94 and a deductible of $10,500 with a maximum out of pocket of $10,900. From the first plan, it's a much higher monthly premium, but if you were to need healthcare services, you could potentially save thousands over the year. And those were just two examples. In total, there were over 50 different plans that you could choose from, meaning there was no shortage of options across deductible levels, networks, and monthly costs. The credit doesn't force you into one type of plan, it actually just gives you choices. You can prioritize the lowest possible premium, or you can trade higher premiums for lower deductibles and more predictable costs. For many early retirees, this flexibility is what makes retirement before 65 viable due to the amount of choices and subsidies that are offered. But the real takeaway goes beyond plan selection. The most important factor in all of this is not which insurance plan you choose, it's how your income is structured. Marketplace subsidies are extremely sensitive to income thresholds, and small changes can lead to massive consequences. For example, I ran a scenario for a married couple earning $84,000 per year, and at that income level, the marketplace showed a monthly subsidy of $2,255 or $27,000 annually. But when I increased their estimated income by just $1,000 from $84,000 to $85,000, that subsidy disappeared entirely. Now, I know what you're thinking. That's a shocking difference. And it is, but it isn't as shocking as how many of you who watch this video aren't subscribed to this channel. So if you're enjoying this video, please subscribe. Now, back to the actual content. For a single filer, the income cliff that I discussed is just as dramatic. At $62,000 of income for a single filer, the subsidy was $962 per month, and at $63,000 of income, it dropped to zero. In other words, one extra dollar of income or one poorly timed stock sale can cost thousands of dollars per month in lost subsidies. And that's not an exaggeration. One capital gain, one bonus distribution, or one unplanned withdrawal can turn affordable insurance into unexpected 5-figure annual expenses. This is why planning around insurance and early retirement matters so much. Dividends, capital gains, interest income, IRA distributions, rental income from real estate, and even certain Roth conversion strategies all feed into the income number used to calculate subsidies. Without coordination, it's easy to accidentally cross a threshold and give back far more in lost benefits than the income was actually worth in the first place. The bottom line is that health insurance doesn't have to be the reason that you delay retirement until 65. The ACA marketplace can offer meaningful, flexible, and affordable coverage, but only if income is intentionally structured. For those considering early retirement, understanding how these subsidies work and planning withdrawals and investments accordingly can be the difference between retiring with confidence and working years longer than necessary. Hey, if you like this video and are interested around how taxes also change in retirement, I have a video showcasing the differences of taxes before retirement and taxes in retirement, and you can click here to watch that.